Good afternoon. Welcome to Healthy Lifestyle. I'm Lorianne Casdia. Our goal at Healthy Lifestyle is to inspire, educate, and empower others to fulfilling a healthy, emotional, spiritual, and physical life, so you can feel empowered to live the life you have always wanted and dreamed. We are here today with our friend Ruth Ellerd, who is a licensed clinical social worker. We welcome Ruth back. She's been on before and has a certification in rational emotive behavioral therapy. Welcome, welcome.
Thank you.
No worries.
Thanks for having me back.
Happy to have you back. So much to talk about. We left off talking about so many different topics that we need to have you back a lot so that we can cover these topics.
Well, I appreciate that.
Oh, no, our pleasure. We received a lot of nice responses
to
it.
Thank you.
Yeah,
That's
it was good. So one of the things that I love about your practice, and you can visit and see this on ruthellerd.com, right?
That's right.
Is that you are pet friendly and you have pictures of your owner's pets. I love that. Talk about that.
Well, they have to be with me, of course.
Yes, of course.
And the owner has to agree that the pet is allowed to be on my website.
Okay.
Yeah, so I don't really make them sign a release or anything. But no, I mean, I think that people bring their animals anywhere. You know, we have this whole companion pet, age coming about with travel. I mean, Southwestern is one big one that lets pets on very frequently. And I'm sure others do too. And sometimes I can write letters for people.
Nice.
To say that, they're companion pets and they need to travel with them. So I welcome them, and as soon as I find when I do an initial intake, so I'll do a family tree, and then I always ask about the pets to make sure that there are pets in the family. Okay, so if they have a pet in the family, please be you're welcome to bring your pet. The pets make them comfortable. Yeah. I had my own pet there, but when he died, I was able to allow others to come in because Cuisinart, my pet, was so territorial. Nobody else could come into the office.
Well, protecting mom, I'm sure.
Very protective.
Yeah, that's good. That's good. Yeah, no, that's a really nice environment, and I love the pictures. If you get a chance to go see it, Ruth Ellerd, ELLERD.com. You'll see the pictures under gallery. And they're so cute. The latest one. Oh my God, the Yorkie.
I hope did he get on yet?
He's not on yet. I believe he's coming on this week.
He's gorgeous. Yeah, I just saw him Saturday.
Oh my God, so adorable.
Yeah,
adorable.
Yeah,
so
I got to hold him.
Yeah, look for that. You said somebody had a snake too.
Yeah, she might want to bring the snake in. I'm not sure.
Wow.
But I'll put it on.
Yeah, why not,
that's
right?
her companion.
Yeah.
Like if she, I don't think she'd get on a plane with the snake. I think that's where they would draw the line.
Well, I think that movie would preclude that from happening
now,
now, right?
Remember that?
Yeah, I do.
Yeah, I forgot who was in it.
I don't remember who was in it. I just remember, oh my gosh.
Yeah, there was a lot of snakes on that plane.
That gave me a lot of anxiety. Speaking of which.
That's a good segue.
Thank you. I wanted to talk to you about anxiety and the physical reactions that people have that either kind of signal that you're having anxiety or is caused by a factor of anxiety. So let's talk about that because I know that there are people, myself included, that have had anxiety and had very, I would say, detrimental physical reaction from it. Like your body actually almost puts out red flags and says, I give up. And if you don't pay attention to the little messages it gives you, it continues to elevate the messages and get stronger and stronger and louder. Yeah. And because I have colitis or had colitis, I haven't had an attack in years. Right. And IBS and, diverticulitis, diverticulosis. The whole 9 yards, very, very relative to stress. I always loved it when my general doctor said to me, well, you need to eliminate the stress. Thanks, docs. That's really helpful. Yeah, really helpful.
Doesn't happen.
It's not easy. Stress is stress. You have to learn to deal with it in a better way. But do you find that that is your physical reaction, is your body saying, time out?
I think in a lot of cases that I walk through my door, what I'll see is some of the, I call the dumping ground of like the rule out syndromes of like, okay, so we don't meet the clinical medical diagnosis for this. So we're going to put you in an IBS category, or your muscles are aching for years and we can't figure anything else and blood work is good. So you've got fibromyalgia. You're not sleeping or you're sleeping too much is a sleep disorder or chronic fatigue syndrome. To me, and especially for me personally, I mean, I was in an IBS category for years, only to find out much later that it was a disease. It was colitis. It was a very rare, like a rare form of colitis that was recently diagnosed. But I think that since I'm the cognitive therapist, it's kind of difficult for me because I'll look for those things, but I'm also looking for thought, what I call like a thought root, which is what's the thought that's triggering anxiety. So you don't always get that with people. There's a lot of people that will come in and say, I don't know why I'm so anxious. Nothing's changed. Yeah. There hasn't been any major trauma. We'll talk a little bit about trauma in a bit, but there hasn't been any major and recent trauma. But I'm out of sorts. I don't feel well. I've lost interest in my hobbies. I'm not motivated to get up and go to work. I mean, some people are even saying, I'm not motivated to get up the next day. So it's like a passive suicide, a suicidal ideation where they don't want to wake up. So if you can't talk and identify that specific anxiety, then it becomes there's something going on, and it takes work, maybe months to figure out what that is.
Well, so yeah, I can understand that, and to me, I liken it because I'm very visual. I liken it to almost like a pile of hay. So every piece of straw, every piece of hay, if it is, in that pile is a different issue.
Right.
And so now you have to go through that pile of hay that you've either accumulated over years or the last few months. Yeah. Most of the time it's over years because we ignore it and we ignore it until all of a sudden it's so big that we can't get through it.
Right.
So now we can't identify any one thing because it's so many different straws. It's so many things that put us in this state.
Right.
So you actually have to dissect that pile of hay and separate it into, okay, that's not a me problem, that's a them problem, and this is a me problem. So I need to focus on this, and this caused this, and this is why I was upset about that. And you actually have to work your way through it. Am I right?
Right.
Yeah. So when people do that, and that's why this kind of talk therapy, cognitive therapists, having social workers or anyone that you can talk to is important to talk it out, because I think it leads you to that understanding of why you feel the way you feel, because we don't get up and go, oh, I feel this way because blah, blah, blah.
Right.
We generally don't think about why we feel the way we do.
Right.
But if we're not feeling well, it's hard to pinpoint.
Right.
So how do you take them through that process, Ruth?
Well, everybody's different, and everybody's description of anxiety, it manifests so differently. They feel it. So I'm anxious could mean 100 things to 100 different people. What I think is important is that I can recognize their discomfort and try to get them to even identify something that's happened before in their lifetimes that they did not consider to be trauma. So even if we go back to childhood, we can talk about things like parental abuse, any sort, physical, verbal, mental, emotional, neglect. Those are pretty obvious things. But a lot of times kids will experience trauma as a child. They're not saying to themselves, oh my God, I'm experiencing trauma. They're just surviving.
Right.
And
I don't think anybody going through trauma, tell me if you agree with this, I don't think anybody going through trauma ever identifies it as going through a traumatic situation.
Sometimes they don't even think of it as trauma.
Yeah.
And it could be something as simple as my mom was sick for a year with cancer. And that child would have had, something like that is traumatic to a child.
Well, define trauma, because I don't. There are certain terminologies that I find are overused, but define trauma.
Okay,
what would be traumatic?
Trauma is anything that has happened to you at any point in your life that impacts your functioning. So if you experience, let's say, a divorce, it doesn't even have to be an ugly divorce. It could just be the loss of what it means is a breakup of a family. It could be the loss of a household, the loss of income. That's trauma. That's going to affect the rest of your life.
So it's a major negative change?
Yeah.
Okay.
Basically.
You are listening to Healthy Lifestyle. I'm Lorianne Casdia on Long Island News Radio 103. And we are speaking to Ruth Ellerd, and we're talking about trauma. And there's another word that I find is overused and I think in a lot of cases misused, which is disease.
Yeah.
That is everything now is a disease.
Right,
everything is a disease.
Right.
What's your feeling on that? Because I have very clear feelings on this.
Well, there's disease and disorder. So, do you want to read the? Well, remember I did the Merriam-Webster dictionary lookup on disease.
Yes, you actually did do the definition.
Yeah.
But when we look at it, let's see. The definition is a condition of the living animal or plant body or one of its living parts that impairs normal functioning and is typically manifested by distinguishing signs of symptoms, sickness, malady, etc. So yeah, that's what disease is, but it's not, everything is labeled a disease because they don't, I guess a lot of people don't like the term disorder. So something which is not in order. True. Now we use dis-ease, which is two words really. It's dis-ease.
Yeah, and that's
you're
why
not at ease, right?
And people don't think of that as I'm not at ease with my body, with myself, with my mind.
Right.
The dis is the not, and the ease is ease. It's peace.
Right. So my take on it is, whether you agree or not, this is just my personal take on it, is there are certain things that I call diseases that are out of your control. To me, that's a disease. Not a dis-ease, but a disease. So cancer, you getting, you have breast cancer, you have some kind of cancer. That's a disease. Right. That is something that's out of your control. And now you have to take something and take action to hopefully mitigate that. Right. There are other things that are in your control that you make choices to do, which then cause other things as a result of those choices you made. And I'm not going to list what I think that they are, but there are things that we do that are now labeled diseases that I don't believe are diseases. I think that you're not at ease, that you're dis-ease, that you're having some kind of discomfort. Your body is reacting negatively and becomes more and more a violent negative reaction the more you do it. Right. So, I have someone who I know very dear to my heart, and they have a really bad physical reaction to drinking. And every time it gets worse and worse and worse, and yet they keep drinking. And I'm like, oh, okay, when's the bell going to go off? And it's their choice. It's their life. It's their decision to make. But every single time they get a really bad physical reaction. To me, it's your body screaming, you have to stop. Enough is enough. Right. So, and they've been doing it for a very long time. Right. And I fear that it's going to, they don't drive or anything. They're not haphazard about it. But still, they're getting physical reaction to it. So to me, don't you think that do you believe that word is misused?
Yeah, maybe not exactly the way you're defining it. Although I do agree with you. I think a disease is definitely kind of taken over by the medical community. So when we're talking about psychiatric issues, we refer to them as disorders.
Yes.
Now that creates a line of stigma, because with a disease such as cancer or many other illnesses, it's out of their control.
Well, it's a societal different reaction.
Right.
So,
like, I can't help myself. I have a disease. But with a disorder, people kind of look at that and say, well, it's a disorder, so you can help it. Right. So it is kind of it's kind of a choice. And so with the multitude of disorders that are listed in the DSM that we use to label all the illnesses, the psychiatric illnesses, then there's that stigma of, well, it's a disorder. So, something like anxiety, well, you can help yourself, but you really can't. it kind of does fall into a disease category, but the medical community has grabbed that away from us centuries ago.
Yes. Yeah. It's an amazing thing. This could be a very long conversation about that, but let's return back to anxiety and some of the physical reactions that one gets, and the elevation of those reactions as we ignore our anxiety. So where are the points where we should start looking for it and going, okay, something's going on? What are the triggers? Or probably not a good word to use when we're talking in this industry, but is it a trigger? Is it considered a trigger?
For a lot of people, anxiety is triggered.
Okay. Yes.
By certain either external events or internal event. An internal event is a thought, which sometimes, they can't even identify it. They just know they don't feel well inside. The external event could be a change in environment. Like I've said, a change in their lifestyle, could be a career change. So the things we're looking at are, the symptoms could be a mile long. The person is usually complaining of not sleeping, change in diet, or that they've stopped eating, or they're eating too much. They're thinking too much. So that's where it helps me a lot when somebody comes and they're anxious and they're thinking too much. So then I kind of segment, well, what kind of thinking are you doing, and how is that hurting them? And a lot of people are really good when you give them scenarios of it's this type of anxiety, this type of, and I mean this type of anxiety thinking,
right,
or the thinking that's causing the anxiety. I should say, I said it backwards before. Is that you're thinking this way, which is causing you anxiety. So if I give them examples, and they oh yeah, I do that, past scenario replay. Something happens, the previous day or whatever. Replay. And it's a replay, or it's a what if scenario. A lot of there's which we call, the common worry wart. Right. What if this, what if that, and then they go into a spiral. So those are a real common things that I can see. I mean, the physical stuff is just that they don't feel well, and that's all they can tell you. I don't feel well. I'm shaky. I'm not sleeping. I'm not concentrating. I can't focus. Right. Not motivated.
Do you think that there's a higher anxiety level, and obviously we can only briefly touch it because we are running out of time, but do you think there's a higher anxiety level as a result of social media and that immediate gratification thing that we're so getting used to?
Major, yeah. I mean, you and I both grew up without social media, and I'm not in it at all, but most of my clients are. So there are some people that actually have asked to stay off Facebook. Do not go on Facebook. Yeah. Do not compare yourself to people on Facebook.
Well, it's bad to do that anyway.
Right.
We're not here to compare each other. We're supposed to be the best us. And as soon as you start to comparing, you're outside of who you're supposed to be.
Right.
So yeah, I feel like it's interesting platforms that cause a lot of anxiety, especially in our younger generations.
Yeah. Well, even in our generation and people that are older, I mean, they kind of start out innocently and they don't know how to handle it. I think the younger people may be better equipped a little bit at handling this like or not like my picture. I have a client who actually becomes so anxious because she puts things on her Facebook, and if her pictures aren't liked enough, she'll go into, this sort of zone of, oh my God, why aren't these people responding to my picture?
Yeah. Again, I think it's a lot of societal pressures that are just unnecessary. Again, as I've said to many people, it's none of our business what anybody else thinks. So we need to continue to think that way.
It's none of our business what other people think of us.
It's a nicer way of saying I don't care.
Absolutely.
But the truth is that's actually the better way of depicting what it is.
Yeah.
It's none of my business what anybody else thinks.
And I have that exact quote right in front of my clients.
Oh, there you go.
Yeah.
There you go. Well, Ruth, it's always a pleasure having you on.
Thank
I'd
you.
love to have you back to talk more about this and many other things.
Yeah, the whole mind-body connection thing is big.
Yeah, it's huge, and we didn't even get to other options.
Right.
And
I wanted you,
and I love the fact that your daughter is an acupuncturist. And you can find her at Megan Ferretti. Sorry, Ferretti. And you, RuthEllerd.com. We can find you there. Go check out the pictures of the pets.
Yes.
And I will have you back. I'm hoping you come back next month.
I will.
I love it. Thank you so much.
Lorianne.
We will be right back. You are listening to Healthy Lifestyle. I'm Lorianne Casdia. Welcome back to Healthy Lifestyle. I'm Lorianne. Well, if you have any questions, comments, or ideas on topics you'd like to hear more about, please email us at healthylifestylewithla@gmail.com. Or you can follow us on social media at Healthy Lifestyle with LA. We'll take private messages. We're enjoying your feedback and we're enjoying your questions. And if there's any type of alternative medicine or practice that you want to hear more about, shoot me a message and we will try to get those people on. In the meantime, this afternoon we have on Dr. Yu from the Eastern Region for Gynecological Oncology for the Northwell Health System. And we're very pleased to have him on. We're going to have a very interesting conversation about something I don't know much about, and I hope I never have to visit him. No offense. Welcome, Dr. Yu.
Welcome. No offense taken. Tell all my patients I hope you never have to see me.
So explain to our listeners what exactly a gynecological oncologist does.
Yeah. It's actually not a common field, and I got into it by just having good mentors. But we're surgeons, and we're sort of proficient in internal medicine for the management of gynecologic cancers. Mostly in the United States, that means cancers that involve the reproductive tract, so the vulva, the uterus, the ovaries, and so forth. In Europe, that also includes the breast cancer. I myself was also trained in breast cancer, but I do not currently practice that here. And
you're basically out of Mather Hospital and Huntington Hospital as part of the Northwell system? That
is right. And also in Southside.
Southside. Okay. Mm-hmm. Okay.
So I joined Dr. Benjamin Schwartz, and he's mostly at Southside Hospital.
Right.
And in this way, we can branch out to some of the other hospitals like Huntington and Mather.
I find some things very intriguing about your history. You're not from the U.S. You came over here when you were 18?
That's right. I initially was interested in pursuing a degree in marine biology, and so I went to Miami and soon realized that it's hard to make a career, and I didn't want to be diving and studying plankton, so pursued a degree in medicine, and here we are.
Wow, that's quite the jump between marine biology over to gynecological oncology. And the other thing I was intrigued from is, where's your native country?
I'm from Slovenia, so that's a former Yugoslavian country. Yeah. It's a small place, but I think recently it's been discovered, and a lot of people now visit. It's a nice place.
The first time I've heard of it was at the Olympics, of course. You know, when they come by with the flag, and I'm like, okay, I have to go find out where that is because I don't know anymore. Because when I was growing up, it was all Russia.
Right.
So that's not the same anymore.
Right. Well, it's a common misconception, and Slovenia has nothing to do with Russia.
Not at all.
It's now Melania Trump made it a little bit more famous, and she's from Slovenia as well.
Yeah. You make them pretty over there.
Well, yes, it's a small, but it's somehow a very athletic country, actually.
Yeah. I wonder why. Is it the terrain?
I'm not sure. It definitely is. It's very geographically diverse. We have an ocean, or a sea, I should say, and then we have mountains. So,
lots of mountains, yeah.
Yeah.
Yeah, it's really interesting. And then you went to live in Moscow before you came here, right?
Right. So when I was 6, my parents decided to move to Moscow. My father had better opportunities for work. I mean, it's what we do, right? It's
Sure.
a global world, so we gotta go where we can get work. So
Absolutely. And now you're a U.S. citizen, as far as I'm concerned.
well, yes,
you're us.
I am.
You've lived here all your life, right?
I am.
Since 18.
Yeah.
That's great. Well, we're glad you're here. We're glad you're here because you provide a good service. So let's talk about more about the different cancers that you treat. Now, I've always been told, and it was my information, we can talk about myths and facts, okay?
Sure.
That when you have reproductive cancers, that's it. There's nothing to do. You can't do anything.
Right.
Myth, right?
Of course it's a myth.
Yeah.
I think what's most difficult about gynecologic cancer is there's a lot of stigma involved, and breast cancer is certainly a little bit different. There's been a lot of publicity and things like that, and it's become a little bit more accepted, and I think women have a lot more support groups that way. But for gynecologic cancer, sometimes it can be quite difficult to get support. Maybe family, but sometimes it's hard to even bring up some of the cancers that you have to discuss it with friends because people don't feel comfortable. And so that's one of the things I focus on, is to make sure that people have a good support system.
I find that that's a common theme with the medical staff coming here on the show and in Northwell, is that you really take a lot of time educating your patients. And I really applaud you for that, because it's really important to give that comfort zone. Obviously knowledge is power, mm-hmm. and you definitely provide power by giving that kind of knowledge to your patients.
Right. I think medicine in the past was very patriarchal. You were told what to do,
yeah.
and I don't like to see medicine that way. In fact, I realize the limits of my power. It's more the way I like to think of myself is more I can guide patients in their journey of hopefully getting better. And I'm there because I've spent 16 years of my life trying to understand what tools and how far we've come in trying to understand it and treat cancer. And so I'm there to really advise them about the choices that they have, because often than not, it really there's no right choice sometimes.
Right. Yeah. No, I get it. It's not our environment. We don't deal with it every day. You do. So you see
right.
What works, what doesn't work, and things that work for one person may or may not work for another, I'm sure. And by having choices, it allows the individual to make a decision. And that's empowering in and of itself, to be able to say, okay, this is where the course we want to take, and these are the reasons why. And you have a lot of empathy that allows people to help them take them through that track, right?
That's exactly right. I mean, one thing, I don't want to get too personal, but if you had any, run-in with the healthcare system, is you'll understand that it's very disempowering.
It's, very much so, yeah. You have to be your own advocate.
Well, yes, and it also it can be frustrating how out of control you can feel. And so I think as much of control as you can give back in this process is really important.
Oh, we need more and more doctors like you, because I'm such an advocate of that. When you're sick, you don't want to can't advocate for yourself. You want somebody to come in that you can trust. And I come from the world of, why are you doing it? Because the doctor told me to. Now right. It's you're not questioning. It's just that you feel the need to have more information. And the more information the patient has, the better they can help you help them, right?
That's exactly right.
Yeah. So that family, because I'm the worst. Oh my God. When I go to see the doctor and they say, well, is anything wrong? No, I'm fine. Okay. So, have you had any pain lately? Oh, well, yeah, that. Well, that's what we're talking about. Why are you here? So, and they have to pull it out of me, and it's not because I just don't think about it. So through your questions and through that kind of training and through being empathetic and through sharing of knowledge, you go, oh yeah, by the way, yeah, that's right. I felt this too. And yeah, I had that numbing in my arm thing. Is that bad? Because I just thought I had a numbness in my arm, had no idea that it was related. In the meantime, there's a big light bulb over your head going, okay, now I know what you got. So
yeah, that's exactly right. And a lot of it is also, you don't want people to shut down. Sometimes it can be very overwhelming, the things we talk about, and you have to present information in a way where it's not overwhelming. And at the same time, you you can get through to the person. So
How do you do that? How do you achieve that goal? It's
really hard, and there's no training. It's basically some of it comes from experiences, some of it just comes from having interpersonal skills, I think.
Yeah. Well, I know you're very empathetic, and I love that. I noticed some of the comments on the website that's associated with your name, and that is something that came up over and over and over. Your kindness, your empathy, empowering them. That's a beautiful thing to say, especially when you think about a doctor. Those words don't always come to people's mind, and it's really nice to know that the doctors from Northwell and you specifically have that associated with your name in such a very delicate topic, because it's difficult to talk about gynecological cancers, and that's really close to people's homes because that's part of reproduction capability. And in the past, I know that, someone would have something like ovarian cancer and they would be like, and game over. And that's not the feeling anymore, right?
No, certainly not. I mean, we try to return as much function as we can, and it impacts all interpersonal relationships. And that's the thing. You have to realize that those things can't no longer just take a second backstage. They're just as important, because just because we can treat something well and then it results in all sorts of damage in relationships and the way the person functions is no longer good enough. We try to focus on our treatments having, minimal impact on other things as well. So all things are important when we're considering treatments.
You are listening to Healthy Lifestyle. I'm Lori-Ann Casdia, and we're speaking to Dr. Yu from the Eastern Region for Gynecological Oncology for Northwell Health. And we are continuing our conversation about different cancers that one might have. Let's talk about HIPAC. What is that?
Yeah, one thing that's been on the news recently. So HIPAC is a type of chemotherapy that's given into the abdomen at the time of surgery. And it's used mostly, the way people think of it is for cancers of the colon. But recently, it's been in the news because it's also used, or it's been looked at for ovarian cancer treatment. And so it's hyperemic is the first word of that HIPAC. That's what it stands for. And what happens is the patient gets surgery, and if we're able to remove all but microscopic disease, she becomes eligible to get this chemotherapy, which is given into the belly before we finish the surgery, and it's then heated up to 39 degrees Celsius, which is like 101 Fahrenheit. It basically simulates the patient having a fever. The reason we do this is because it enables your immune system to mount a response, and it's supposed to have better penetration, the chemotherapy, and it sort of recruits your immune system to sort of fight.
That sounds like you're jump starting the immune system. You're like saying, "Hey guys, we're here."
Right, and that's that's why it's been really exciting, because there've been some good results with it. Of course, this is still in the experimental phase, and we're still trying to understand what is the right time to use it. Should it be done as a frontline treatment? Should it be done after the cancer has come back? Those are all questions we don't know answers to, but it's a very exciting time.
Wow, that is. Well, talk to us about your soon-to-be program, Use It? UZIT, is that right?
Yeah, that's Dr. Schwartz. He's working on as an integrative program that they're going to be launching at Southside soon.
Oh, okay. Oh, all right. I understand. I thought that was part of your program. You're going to defer to Allie. That was Allie. Thanks for jumping on, Allie. Oh, wow, you're beat red again. So we'll go back to the HIPAC, and then there was I'm going to mangle it, so just sure. I apologize, but IVIP chemotherapy.
Right. So something else we provide for our patients is IVIP chemotherapy. Again, this is something that is not as commonly used for gynecologic cancers, and recently has been in the news that may not be as effective. But again, IVIB chemotherapy is that same idea that you give chemotherapy in the belly, but this is after the completion of surgery.
Why is it the belly? Is it
because ovarian cancers tend to spread throughout the abdomen, and so it's also the site where the cancer most of the times comes back. And so we know that that's most likely where the treatment's going to fail. And so these treatments, they focus specifically on the abdomen and trying to permanently kill the cancer cells. And there's total 4 studies that are high quality for IVIP chemotherapy, as we like to call it for short. 3 of them are positive, meaning they show good results, and 1 of them is negative. And it's remarkable how much of an improvement it makes in the right patient, and specifically the younger patients, which is what how I tend to use it, because it makes the biggest difference for them. It's a little bit of a tougher treatment to go through, which is, I think, where some studies come short, because people can't tolerate the full treatment, and so then, you're not going to have the full benefits of it as well. And this is why I think in younger patients it makes more sense, because they can usually tolerate all the treatment.
Right. Is it a long process?
It's not the length as much as sort of the side effects sometimes, the short-term side effects.
Right.
Not the long-term, but it's tougher as you get older to go through that.
I feel like when you're doing that because you had said that it infiltrates the abdominal area, that it's almost like you're damming it up by stopping it at the worst spot, so that what's happening, you're taking care of lower. In the meantime, you're damming up the possibility for it to do that infiltration into that difficult area. So
let me just explain a little bit about how we treat ovarian cancers. We'll back up. So ovarian cancer is a 2-part sort of approach. One is the surgical part, and the other part is the chemotherapy. Ovarian cancer most of the time requires the 2, because most of the time it's diagnosed in stage 3 and 4. There's only about 22,000 cases in the United States a year, and about 70% or more are advanced, so stage 3 or 4. In early stages, sometimes chemotherapy can be avoided, and certainly the outcomes are a lot better. And so that's why I'm saying that most of the time it's a surgical and a chemotherapy approach.
Right.
So the choice about when to do surgery and when to do chemotherapy is a little bit dependent on how much tumor there is to start with, and if there's any other comorbidities. And so most patients, if they're healthy, we try to do the surgery first and then the chemotherapy after. But sometimes you have to do chemotherapy first to reduce how much cancer there is, and so that the person can tolerate the surgery better. And so you have a few weeks of up to 9 weeks of chemotherapy initially, and then you have the major surgery where we try to reduce the cancer to what we call microscopic disease, or no visible residual disease.
Right. And
that's really the ideal treatment. And then there's usually more chemotherapy after that. So that's sort of how we approach ovarian cancer treatment. And then again, it's a very exciting time because there's so many options now available, and 2 of those options are also intravenous and intraperitoneal chemotherapy, or HIPEC, which is the hyperemic or warm chemotherapy that's given at the time of the surgery.
Right.
And those are all options for these patients.
Just amazing. And how long have you been a gynecological oncologist? Yeah.
Well, I graduated recently last year from Brown and Women and Infants in Providence,
Sure.
and I just came down here to join Dr. Benjamin Schwartz in his practice. So I'm very excited to be here.
Oh my gosh, amazing! And I noticed that one of your biggest achievements is getting into medical school as a foreigner. So That's pretty amazing coming into America, because it's hard to get into medical school. I know, my brother went through that process. It's very, very difficult.
It's tough, even if you're an American, but it's even harder if you're a foreigner with no. At that time, I didn't have a visa. I didn't have any sort of. I had an F1 visa, so I was actually the first foreigner to be accepted to University of Miami.
Oh my goodness!
So,
congratulations! That's quite the the achievement.
My counselor told me I should try to do something else. My undergraduate counselor, because she just didn't think it was going to happen.
Wow. And so that goes to what I always say is just follow your dreams. Don't worry about what anybody else thinks, because it's none of our business. But I think it's wonderful that you make yourself accessible to your patients. And I love that you said this, that you take a leap of faith with them, just as they have to trust your decisions. And you trust them, and you give them your cell phone too.
That's right.
Which is amazing.
I think, it's like I said, I chose the specialty because it's a special profession. So I trust my patients, and I give them my cell phone. If they need me, I know they really do need me.
Thank you so much for coming on today, Dr. Yu. You're an extraordinary person. Thank you so much. It's an honor to meet you. And thank you for joining us today on Healthy Lifestyle. My heart is always lifted by sharing this time with you. I want to thank my guests. I want to thank Brian, our producer. Follow us on social media in the meantime at Healthy Lifestyle with LA. Again, if you miss any of our interviews, you can go on to SoundCloud and look for Healthy Lifestyle. All of our segments are replayed there. Remember, do a little something for yourself every day. Create a habit. Create the new balance. Thank you for joining us on Healthy Lifestyle. I'm Lori-Ann Casdia. Until next time, show up for you. Show up big.